As Washington and the nation react to the sudden death of Senator Lindsey Graham over the weekend, we are learning more about what caused his death.
Yeah, the preliminary medical examiner's report said he died from an aortic tear or dissection. It's a condition that is different from a heart attack and typically affects older men.
News 4's Aimee is working for your health and is speaking with a doctor about what you need to know. Dr. Patel, thank you so much for being with us today. So what exactly is an aortic tear or dissection, and what are the warning signs if there are any?
An aortic tear or aortic dissection is actually a weakening in the wall of the aorta. It's one of your major arteries that pumps blood throughout your body, and it has a strong muscular wall. Think of it as just a really rigid pipe that can get flexible when it needs to be. And in the case of someone with coronary artery disease, or what we call plaque from a buildup over time from cholesterol, that can actually make that pipe leaky. And that results in a pocket of blood that travels outside its normal route into the wall of the artery itself. And it can get bigger and bigger and bigger and eventually bust. And because that is the main artery that brings blood throughout your body, that can result in overwhelming the body and ultimately death.
And you mentioned when it bursts and that happens and the body is overwhelmed. It sounds like this is something that happens very quickly. So what is the timeline from when this happens to when a person needs to be able to get to the hospital in order to have the best chances of survival?
We say in medicine that this can be hours, that every hour that a dissection is progressing can actually literally add to the mortality or cause of death. So I like to tell patients that especially if there's stabbing back pain, chest pain, in the setting of a history of high blood pressure, known heart disease, which includes that buildup of plaque that can happen in your arteries, that really constitutes a medical emergency, and to not wait.
Now, is this something we typically see in older people, or can this happen to anyone? And then also, are there things people should or shouldn't be eating to try to improve their heart health?
In general, this is something that we see in older people. In general, we see it in men, but you shouldn't think that if you don't fit into that category that it can't happen to you. It is not common, but it is something that we want people to be aware of. In terms of diet, it's really more about having kind of an overall healthy approach to your diet so that you can reduce any of these risk factors. So the most important thing is to get diagnosed, to get checked, and if you have a history or even any of these symptoms, to take it very seriously.
All right, Dr. Kavita Patel, thank you so much.